everyone, welcome back to my weekly Sunday 9 p.m. live video. I'm Dr. Tan Ping, consultant obstetrician and gynecologist. And today's topic is all about Bengkung, okay? Bengkung in Malaysia, it is a form of abdominal binder. So any one of you who are from Malaysia who are very familiar with this thing. This is something we wear around our tummy after childbirth, okay? Alright, we've been doing it for probably decades and centuries. But the question is, what are its goods and its bads? Do you actually have any proven advantage of using a Bengkung? Are there any risks involved that we should know about? Alright, most people wear a Bengkung for one particular reason. They want their tummy to shrink, right? They want their tummy to flatten. Because after childbirth, you see our tummy is still so big, right? Even though the baby is out, I still remember some of the mothers would ask me, Doctor, my mother asked whether there's another baby inside, why my tummy is still so big after giving birth. No, because after we give birth, many of us, our tummy is still very big. Okay, so that's why we want it to flatten back so that we look good. So that's why we wear this Bengkung or the abdominal binder. These are the reasons why most people actually use it. But medically, do we have a reason to use it? Actually, abdominal binder is something that we use it quite often in certain medical situations as well. And usually we will just like, if I want to have an abdominal binder for a certain patient, I will just write a referral letter to the physiotherapist. Usually what happens is in the hospital, the physiotherapist keeps the abdominal binder and they will go to the mother or the patient to measure and then they will get the right size for them. So of course that one is not the same as Bengkung because Bengkung is made of cloth and you have strings to tie. But in the abdominal binder that is given by the hospital is usually elastic and it's just a velcro where you just overlap it and it will stick, okay? Why do doctors actually recommend this abdominal binder? Number one is for women with after cesarean section. Actually, after cesarean section, we have advantage to wear the binder. So some of the mothers who are aware, they actually bring to the hospital and they say, good, wear it. Why? Because wearing this binder actually fixes everything. So you see, when you move after a cesarean, it's actually quite painful. But if you were to wear a binder where you fix everything, now your tummy, your muscles, everything will be fixed and hold on to by the binder, then actually moving around after an operation is less painful. So we know one thing, abdominal binder do reduce the pain. Because you must understand, when we do a cesarean, we go through many layers, including the muscles. And because you have wound inside there, if your muscles are working very hard, contracting all the time, then you actually get more pain. If I use something to wrap your tummy and hold your tummy in a way where all the muscles do not need to move much anymore, this is when you actually feel less pain. So isn't it good? Everybody after Caesar, they are worried about post-op pain. So if you wear a Bengkung or you wear abdominal binder, you actually can reduce the pain. So for all of you who actually give birth in the hospital with cesarean, if you do not have a binder, you can still request it from your doctor. Then your doctor can always request it from the physiotherapist. So usually physiotherapists, they will measure your tummy, measure your waist, and then they will get you a binder that is not too tight and not too loose. Just nice for you. And that's the most important thing. Not too tight, not too loose. Other than abdominal binder for post-op pain, it does also show that abdominal binders also reduce the amount of post-delivery bleeding. So you actually bleed less. You actually bleed less from your uterus. So it's again a much better thing because we divide two groups of women. One group with no binder and one group with binder. After 1 month, we compare what's the difference in the hemoglobin level, which is your blood count level. So if you do the blood count level after giving birth and you do it after 1 month, whether with binder or no binder, we found out that women who wears the binder actually have less drop in the hemoglobin level. Less drop because we know that during confinement we do bleed. We bleed for the whole month. After childbirth we bleed a lot. So having the binder actually reduces your total amount of blood loss. So it's again an advantage. Okay? But there's one more situation that women are actually worried about, but a binder may or may not work. What women are worried about is usually the tummy, right? Women are always worried because our tummy is very big. That's why we wear the Bengkung, right? We want the tummy to shrink. There's one situation that happens after childbirth. Actually, what happens after childbirth, there is a situation called diathesis recti. Diathesis recti or rectus abdominis diathesis. So basically, it's our muscle. This muscle, which is our rectus muscle. We have two layers, two rectus muscle right in front of us. And in the middle, it is not stick to each other. So what happens in childbirth, when your tummy start to expand, this thing actually separate out. Especially women who doesn't have very good core muscle strength. Core muscle strength is this muscle, your rectus abdominis muscle. If your rectus abdominis muscles are not strong, so when your tummy grow bigger, that is when it starts to open up. And worse off if your tummy is very big, like if you have a very big baby, or maybe you have a pair of twins, it can open up really a lot. And after childbirth, they normally don't get back in. So what happens is, if you don't get back in, then they actually form a bulge. It forms a bulge. Because in the middle now, there is no muscle in the middle of your tummy. So everything from inside your tummy will bulge out. And this situation you will know when you try to get out of the bed. When you try to get out of bed, you actually see in the middle of your tummy, there is like one bulge, a long bulge. Okay, so your whole tummy will be from the side like this, and in the center is like this. Center is like this, and the side is like this. So this is what we call diathesis recti. And this is actually the main reason why women's tummy are still very big after childbirth. So if it's not very bad, of course this abdominal binder does help because it flattens, and hopefully as it flattens this recti, these two muscles at the side, because the muscles are now separated at the side, so in the middle there's a bulge. So hopefully as you wear the Bengkung, it will slowly bring it back to the center. That is provided your diathesis recti is not very bad. The very bad ones are what? After childbirth, I have seen not many, but there are some where when they try to get up, this bulge appear and never went back down. That means now they stand up, also this bulge is there. It's always there and it cannot go back down. That means tummy, even they lie down flat, the bulge is still there. These are the cases where the diathesis is too bad, and these cases can be quite painful too. So in these cases, then we definitely need to send this patient to see physiotherapists where they will slowly help them to strengthen back the abdominal muscle to build it back, to flatten back the tummy. So some of you, I'm sure many of you have given birth. You should try this after this. Lie down flat. Like, try to do a sit-up. Don't do a full sit-up. Just do half a sit-up and look at your tummy. Does your tummy have this bulge in the center? If it has, then what you have is rectus abdominis muscle diathesis. Okay, diathesis means it's a gap. So this is the reason why a lot of us, our tummies are still very big after childbirth. So it helps in flattening if you wear a Bengkung, if it's not so bad. But if it's a very bad one, normally it's best not to actually flatten it. It can cause a lot more pain. So you may need to see a physiotherapist. But we want to flatten our tummy after childbirth by using this Bengkung thing. Yes, it helps, but there is a disadvantage. What is the disadvantage? So when we put this Bengkung or the binder, it actually replaces our natural core muscle. You must understand, all of us are supposed to have core muscle, our muscles around our tummy, all the way from the front to the back. And these muscles actually hold our body straight as well as protect our spine to keep it straight at all times. So when you are pregnant, if your core muscle is weak, that is when your rectus muscle will separate. If your core muscle is strong, it does not separate, or it may not separate so badly. So that is why you do see some women, after childbirth, the tummy immediately flatten, and you are wondering why their tummy flatten and your tummy never flatten immediately. One of the reasons is due to the abdominal muscle. So if your core muscles are strong during pregnancy, it doesn't open up so easily. But if it's not strong, that is when it opens up. So if your core muscles are strong, then after childbirth, it will flatten back very fast on its own. If not, then what you do is you wear the Bengkung or the abdominal binder. But what happens is that when you wear that, it gives you the support. Very good. Your posture will be straight. You can sit up straight and you stand also straight. It protects your spine. It's very good. But there's one problem. Then it actually takes over the role of your abdominal muscle. So when it takes over the role of your abdominal muscle, then after your confinement, you no longer wear it, then your abdominal muscle is still weak. That is when you will slowly lose your posture and your core strength. When you lose your core strength, you have more problems. You have more backache problems, you have more pelvic bone problems, right? Many of us do feel that, isn't it? After confinement, we get backache, we get this and that. One of the reasons is also because we wear the Bengkung. So to prevent that, we never say that you cannot wear. You can wear, but don't totally wear it the whole day. And don't wear it for too long. That means don't wear it like for 2 months, 4 months, 6 months, 1 year. So honestly, most important thing is still your core strength. If you have good core strength, you don't have this big tummy anyway. And you don't need to wear Bengkung or abdominal binder after that. So how to get your core strength? That is when pregnancy, we need to do antenatal exercises. Actually, when you go anywhere and ask people about antenatal exercises, we concentrate a lot on core muscles. Because if you have good core muscle, number one, you have less backache, less hip ache, less of all this pain during pregnancy. Number one. Number two, you also easier to push the baby out because the strength to push baby out during childbirth is actually again your core muscle. Number three, after give birth, your tummy is flattened. Then you don't need to wear anything. So if you want to wear Bengkung to help you to flatten your tummy, no problem. It definitely helps. It definitely helps. And it's good because it keeps your spine straight and everything straight. But don't wear it for too long. Confinement, that's it, yeah? Don't wear it until you go back to work and for years, yeah? And please, when you wear, don't wear the whole day so that you give your body a chance to get back the core strength. So you need to do a lot of core muscle exercise. That's why that's very important. You need to train your core during pregnancy as well as after childbirth. Then there is one more question that someone asked. Actually, the question was, does Bengkung cause prolapse? Does all this Bengkung cause prolapse? My answer is yes and no. Why? Number one, if you wear a Bengkung that is not too tight, we don't want it to be too loose, but we also don't want it to be too tight. So when it's too tight, there's a lot of pressure on your tummy, right? So there is a pressure downwards as well. So we worry about prolapse. But we know one thing. If you go back to my video on uterus prolapse, I have already explained it. You don't prolapse for no reason. You prolapse because of your pelvic muscle weakness, as well as mainly actually the tear in the pelvic floor muscle. So during childbirth, a lot of times pelvic floor muscle actually tears, and because it tears, these people have actually a weak point down there. You actually have a hole down there. It's not your vaginal hole, it's your pelvic floor muscle. There's a hole, and this hole, it is a point of weakness. So if you cause a lot of pressure downwards, and that is when you have a risk of prolapse as well. So other than core muscle training, we also need to do pelvic floor muscle training. So these are the basic exercises that we teach all pregnant mothers. In our clinic, after 4 months, all our pregnant mothers get an antenatal exercise video that we share to them, as well as it's available in my quarterly Journey to Parenthood seminar. So it's an online seminar that you can register if you're pregnant, that you will learn all these things. Mainly is to strengthen your core muscle as well as your pelvic floor muscle during pregnancy. In our clinic, we have a program where we have level 1, 2, 3, 4. So they actually go more and more difficult with time. So initially we give them level 1. After 1 month, they come back. And if they say they have been doing it well and find it quite easy to do, then we give them level 2, level 3. And hopefully before they give birth, they have completed at least 3 levels. So when we do that, then we provide our mothers with strong core muscles as well as pelvic floor muscles. Then they don't have to worry so much after childbirth about tummy being big, about pelvic floor prolapse, about uterus prolapse, because your core and your pelvic floor muscles are strengthened. And this exercise normally we encourage women to do not just during pregnancy, but also after childbirth. But as usual, not everybody is hardworking, especially when it comes to exercise, but they don't understand that it's actually very important for number 1, to reduce this big tummy after childbirth. Number 2, to reduce prolapse. Number 3 is to make your birth easier. You know, a lot of people will tell me they do a lot of squatting and things like that. I mean, squatting is good. I'm not saying no good, but never forget your core muscle exercise. Because your core strength is the basic strength in your body. If you have weak core, you don't just have back aches. You have, you know, a lot of pregnant women have these aches behind their buttocks, down to the legs, and they also, that's the hip pain, pelvic floor weaknesses. All these have all got to do with core muscle exercise, core strength. So it is very important. And last of all, a small disadvantage at times when you wear Bengkung or abdominal binder is allergy. Of course, if you buy a cloth-made Bengkung, then it may not be so much a problem, especially if the cloth is made of cotton. But when you buy the elastic ones, because now they are synthetic material, they are elastic material, sometimes it can cause a little bit of allergy problems. So I usually tell mothers, don't wear on your skin, always wear clothes and wear it over your clothes. But at the same time, it's not so breathable, so allergy can still happen, but that is small matter. The main problem that we know about wearing Bengkung is actually, number 1, we worry if your pelvic floor is already torn due to childbirth and you wear the Bengkung too tight. That is when we also worry about prolapse. And second is, don't wear it for too long, because then you will weaken your core strength, and if you weaken your core strength, you will have a lot of backache problem, hip ache problem, pelvic problem, a lot of pelvic floor weakness, a lot of things will come in, because core strength is the most important strength that we need in our body. Core strength exercise is basically to strengthen your abdominal muscle. So the best things to do is actually plank. Plank is the simplest thing you can do. Plank, of course, people do sit-ups, leg ups, cycling on the bed, you know, you lie flat on the floor or yoga mat and then you bring up your leg and you cycle. So these are simple things that we can do for core muscle exercise. But of course, as you progress, sometimes you find that all these things is too simple, you can always upgrade. All these things you can always find on YouTube, core muscle exercises, as well as you can always attend some classes like maybe Pilates or see the physiotherapist. So usually it's muscles that involve the tummy. The easiest to do is actually plank. You know, plank we can always do like half a second, half a minute, then we can slowly increase to 1 minute. We can later increase to just one hand instead of two hands. You know, there are many things you can do with just a core exercise that can strengthen your core even stronger. Okay? It all depends on whether you are natural birth or Caesar. Of course, Caesar, we need to wait at least 6 weeks. We need to wait for the wound to heal. If not, then your core, when you do plank, it will be very, very painful. But then, if you're talking about natural birth can start almost immediately. So you look at your own recovery. After like maybe 3 to 5 days, if you feel like you're super back to normal, you can walk like normal, you can run like normal, not much pain anymore in your wound, maybe after a week or two the most, then you can start already. Okay, one of the reasons why is also because probably you have pelvic floor weakness or your core strength is still not strong enough. So you're doing housework that probably uses a lot of core. So actually that's not the way. You see, when our muscle is not strong enough, if we overstretch it, that's when we cause pain. It's like if you have no good quadriceps and you like to climb stairs every day, eventually you're going to get knee pain, okay? So you have to train your muscle first before you can do strenuous work that is using the muscle. So it has to come step by step. So if you're during pregnancy, you never train your core strength, then after childbirth, you start doing all kinds of so-called housework that uses the core, then of course it's going to cause you pain. You are more likely to get injury. That is why you need to continuously train your core throughout pregnancy. One of the things that women don't do during pregnancy is that they don't even get out of the bed on their own, and that sometimes can also weaken their core strength, because when you get out of the bed, you will use some amount of core muscle. So don't ask your husband to carry you up. You must always say, it's okay, I can do it myself. That should be the way. That is when your tummy can continue to exercise and work on your core strength, okay? So it is again back to all your muscle weakness. So if you have a strong core and pelvic floor muscle, you don't need all this support. All this support is again because women do not have these strong muscles. So that is why they end up having problems and they need something to support. So yes, it's good if there's a lot of pain. A lot of people, every time they get up, there's so much pain in the lower part of their tummy. So that is why they wear the support. But in actual fact, the right thing to do is not to buy the support. The right thing to do is to go for antenatal exercises. There's so much antenatal exercises out there. We have antenatal Pilates, we have antenatal yoga. There's so much out there. But there's a problem with all these antenatal classes I saw over the last 20 years I've been working. Whenever they have a class, they end up closing the class. They have a class and then they close the class. Why they close the class? Not good response. You see, pregnant women do not prioritize exercise. That is the problem. And not to mention our old traditional thinking. I have some women who are very fit before pregnancy. I told them, go ahead and continue, go to the gym and exercise. Then the mother will scold them, mother-in-law will scold them, husband also scold them. Husband scold them very easy. They'll bring the husband to see me the next time. And they say, Dr. Tan, exercise good or not? I say, go and do. And then they look at the husband. See, I told you, Dr. Tan asked me to exercise. But the mother-in-law, sometimes it can be a problem. But actually, and pregnancy, exercise is very important. When you have good core strength and good pelvic floor strength, you don't have all this backache, hip pain, pelvic floor pain, cannot carry your own uterus that you need a belt to carry. So most importantly, after your baby is stable, usually from the 4th month onwards, we should start and do some form of exercises, even if you have never been the exercise type of person, okay? You don't do exercises regularly, pregnancy, we should start. For those of you who have been exercising regularly, you just need to consult your obstetrician to see what kind of exercise that you have been doing and what you can still continue to do, and just continue. You don't need to stop at all during pregnancy, yeah? Okay, we wear Bengkung for Caesar. It is specifically for Caesar. We start after 2-3 days after the Caesar. So you can start at the hospital itself because it's for pain reduction. Mainly when you start to come down and walk. So let's say the 2nd day you are going to walk, you can already start to use it so that your pain is less. You wear it until there's no more pain. When there's no more pain, you don't need it already. So Bengkung is good for post-Caesar mothers to reduce the pain. It is very, very good and I highly recommend it. Yeah, number 1, the recommendation is not to wear more than 3 to 6 hours. I think 3, maximum 6 hours a day. Don't wear too long and don't wear for more than 4 weeks, maximum 6 weeks. So confinement period is the most you wear it. After your confinement, either you are a 4-weeker confinement or 6-weeker confinement. After your confinement, you should not wear Bengkung anymore. And every day you should only wear minimum 3 hours, maximum 6 hours. Don't wear for 12 hours, 24 hours. We still need you to use your muscle. You need to slowly train your muscle. I guess that's all for now. So for all of you who have missed my previous videos on uterus prolapse, please go to my YouTube channel, to know more. And that's all for now. So see you next week, same day, same time. Thank you. Bye bye.